Hi guys, I'm gonna go over a quick video, probably gonna be pretty short, and it's gonna be about the MMI multiple mini interview that you have for entrance into a medical program in North America, especially in Canada. So, what it's gonna ask you basically, I'm gonna categorize it into six to eight different criteria that they're really testing you on. So number one is definitely going to be an ethical dilemma. So might be given a scenario where a doctor and patient is refusing, where you're the doctor and the patient refusing life-saving treatment due to personal beliefs. You believe that this treatment is essential for survival of the patient. How do you proceed? So, key skill here they're testing is ethical reasoning. Um, who has patient autonomy, communication, and how much compassion and empathy you feel for the patient. So, how I would deal with this question is basically I would look at charts and historical data and decide if the patient was okay when it was under the doctor's control, or they were just maybe suicidal if they weren't. And I could explain it further, saying that for the well-being of the patient and people that care for the patient, it's better for him to um, give the autonomy to the doctor to decide what's best for him or her. So that one is kind of like a tough one, but you have to stand your ground and you have to kind of go with the cues and the questions. Okay, number two is breaking bad news scenario. A patient has been diagnosed with terminal illness and you have to inform them how you would deliver this news. Key skills, same thing, empathy, communication, and professionalism. Breaking bad news is going to be part of your role, and if you have good people skills, you can break it in a professional manner. But that's a tough one because it's gonna get better with practice. And number three, they could test you on a scenario one, teamwork, collaboration. So basically, you're working with a team of a healthcare professional, and one of your colleagues is not contributing to the group project. How do you address this issue? So emphasize that the team needs to work and pull the weight together and do teamwork. Conflict resolution, what's stopping the person from producing and delivering on their part. Take leadership, maybe kind of mentor them if they need help with getting started. That's the hardest part on the project. Get them started, give them hints, cues to get that project started and off inertia to momentum. Key communication, keep it professional and based on the project scope. Nothing personal should be taken or given because we don't know what the person is going through. We don't know the full picture because it could be that they're having a rough situation in their life that they're not sharing with anyone. And it's better to focus on the scope of the project and the delivery method to get that done. Because you want to emphasize that we need you as part of our team member. You're good at this, you can get this done. You're good at writing the draft for presentation, you're good at making the slides for presentation, you're good at this topic of research, so help us finish that. Keep it to that because it could get unprofessional if you dig deeper into their personal life, right? So number four, it could be like a conflict resolution question where two people in your team have a disagreement about how to handle a situation and how would you resolve the conflict. So you're the mediator, and conflict resolution, leadership, and interpersonal skills has to be top notch for you to survive as a physician. So anything in conflict resolution is to decide who's going to be the bigger person and move on with the issue that you might have personally with the person, but decide on a factor that's going to get the deliverable of the project ahead and put that forward. So take initiative and leadership and communicate all the pros and cons. Conflict resolution, that's a big one. So you just have to mediate and come up with a solution that's going to work for both parties, and at the same timeline that could work for both board members of the team. And lastly, they could also possibly test you on prioritization and time management. You're a healthcare professional and with limited time, you need to decide which of several patients needs immediate attention. How do you prioritize? Critical thinking, time management, decision making. So who's going to be on your radar first if you are managing a ER triage as a ER doctor? So you have to decide, kind of review the patient file, kind of observe them in the lobby, see who is suffering the most and who you can get in the queue a bit faster because they might be at risk of fatality, right? So that comes with practicing medicine over time and having the knowledge, foundational knowledge, and having the clinical knowledge is going to come over time. It's not something you will know right away, but maybe getting an input from somebody like your attendee or supervisor, or like discussing the case with them, could give you a heads up that this person should be better in the list of being seen before the other one. So that could help you prioritize. The key is communication, critical thinking, and time management and decision making. Another interesting question that they could ask you is social media ethics. So you come across a post on social media where a colleague has shared a patient's private information. How would you handle the situation? Obviously, this colleague shouldn't have done that, but you want to keep it professional because you want to emphasize that according to our hospital and patient and doctor policy, you're not supposed to share the patient information to outside third parties as part of being their care provider. And that might be enough to get that post off social media in most cases. But if it's not enough, then use your ethical judgment on who you can talk to in the hierarchy. Maybe your supervisor identified that the doctor you've mentioned to recommended that it's not professional to have social media posts about a patient and reveal their privacy. So confidentiality in the medical profession comes into play at number one priority. You can be discussing with your family member, friends, especially not bragging on social media about a patient's condition. So as time goes on, I'm waiting for my second round of interviews, and pray for me. Hopefully I get through the second round, and practicing in front of the mirror, writing the questions, using AI, ChatGPT to help me come up with real life questions that they can ask. I order some guidelines, some PDF books. I downloaded some PDFs on medical ethics. I watched TED Talks on medical ethics and dilemmas in the healthcare industry. And I'm still waiting for this week for the TMU admission team to come back with an offer, and I have more time, hopefully a couple more weeks to practice more. So practice is gonna make you perfect, because no matter what, your interview is gonna play a key role. If you practice it enough, you don't mess it up, you have a good chance of presenting yourself and excelling as a physician if you really care for other people and you really want to get into this profession. If you're getting into this profession because you want quick cash money for whatever reason, it's probably the wrong choice. Rethink your decisions. You could probably be owning a clothing store or Instagram and work on it every day for 2-3 hours for five years. You can probably make a lot of money. You don't have to be a doctor. But if you really like helping people like I do, making an impact and reaching the most potential of your own life and making the most impact in somebody else's life at their most vulnerable, and you get to see the improvement, and that rewards you, and the main thing is being selfless in the profession, then you should basically prepare and apply to as many schools and get that acceptance letter. Alright, amigos, super Ferran. I'll talk to you guys later. Bye bye.